Hi, this is Dr. Cordy. The third kind of PCOS is called inflammatory PCOS. And this is a little bit of a rule out PCOS. You don't have insulin resistance, so you don't have the most common or the first type of PCOS. You don't have the post-birth control pill PCOS because you weren't just on birth control pills, but you've got inflammation in your system enough that you may have symptoms like chronic irritability in your digestive tract, like irritable bowel syndrome. You may have skin conditions that are inflammatory, like eczema and psoriasis, or a lot of food sensitivities is really common with this. The other thing you might have is just chronic joint pain or muscly achy pain or a lot of headaches. And these are all more common in this inflammatory type PCOS. And so to handle this, it's much like handling the other two that we really need to look at diet. We need to look at lifestyle and behavior patterns and clean up inflammatory patterns in all of those areas to make sure it gets better. But again, it's really a little bit more of a condition of ruling out the first two of, again, metabolic syndrome and the post-birth control pill PCOS to make sure that we're not overlapping something or we're not just missing something. And we're really getting to this general state of inflammation that, in your case, is causing polycystic ovarian syndrome. And clinically, again, we'll still see high androgens, we'll still see polycystic ovaries, and we'll still also see problems with ovulations in the cycle. But it's coming from this general chronic inflammatory state rather than a specific metabolic syndrome or insulin resistance, or specifically triggered by taking or stopping taking the birth control pill. So again, this is the third type. We have to rule out the first two to get to this third one. We'll talk a little bit about the fourth type in the next video, which is adrenal PCOS, which is a little bit different than inflammatory PCOS and a little bit different than the others. Although, again, there's always some overlap because it's still PCOS. It helps us determine how we're going to show up to treat this and really support the repair of the tissues underlying the cause of the condition itself. Thanks. I hope this is helpful.